Hi, this is Dr. Rollins from the Integrative Medicine Center of Western Colorado, and today I want to talk to you a little bit about stem cells and platelet-rich plasma, also known collectively as regenerative therapies. There's a lot of buzz these days about stem cells, and so I thought I'd explain a little bit about what are stem cells and how does this work. So first of all, we have stem cells in our body throughout our life. Every organ has stem cells, and these are just, think of them like little baby cells that have the potential to become an adult liver or an adult heart or adult skin cells, etc. But stem cells can be used to help regenerate tissue. For example, one of the easiest things to demonstrate would be like injecting stem cells into a knee that's got a lot of arthritis. The stem cells can go in there, and to some extent they can differentiate or turn into adult cartilage cells. But there's limits to what you can do with stem cells as far as how they can convert. So one of the things that we also think about with stem cells, everybody always thinks about this cell turning into another tissue, but there's a lot more to stem cells. They actually have chemicals in them called growth factors. And the growth factors can actually go on to stimulate your own body to do some of this regeneration. So it's not all the stem cell turning into another cell. It's also giving signals to your own body to regenerate tissue and to awaken your own stem cells. Something that you might not have heard of is platelet-rich plasma. There's cells in my body, in your body, called platelets. And these are normally cells from the bone marrow that will help your blood to clot. But inside of platelets, they also have growth factors, and you can actually draw blood, take the platelets, activate them through a special procedure to get the growth factors out of them. In that sense, platelet-rich plasma has a lot of similarities to stem cells and can be used to regenerate tissue. So what we do a lot in our clinic, we can inject stem cells. We get stem cells that are derived from umbilical cord sources, so it's more or less like a blood donor where you get a blood transfusion. In that sense, that's kind of where we get the stem cells, but they're obviously, purified and processed where you get just a little vial of stem cells. But when I inject stem cells into an arthritic knee, or we do other applications with them, basically that's, we've got 10, 20, 30 million stem cells in a little bitty vial. We do the same thing with the platelet-rich plasma though. So the procedure is very simple. We draw your blood, we get the platelets, we process them, we get 6 to 8 cc's of the platelet-rich plasma, and then that's what might be used for the procedure. Now again, I might inject an arthritic knee, that's kind of the easiest example, but I injected a patient the other day who has a rotator cuff muscle that was torn and frayed, not torn completely to where it would need surgery, but it was torn and injured, and the platelet-rich plasma can be used to help heal it. Now this patient might also want to do stem cells at some point. You can actually do both. Generally, stem cells are going to run, 6 to 8 times more money though. So a lot of times I'll encourage patients to try platelet-rich plasma for a couple of rounds, and if that's sufficient, great. If it's not, then they may want to look at going to the next level with stem cells. So if you're interested in more information about regenerative therapies, platelet-rich plasma, or stem cells, please visit our website at imcwc.com or call our office at 245-6911, and one of our assistants can give you more info. Thanks.